The most common diagnosis Dr. Prateet Samdani makes in his clinic is not tuberculosis or diabetes. It is hypertension.
The implications of untreated hypertension is very, very hazardous. Untreated hypertension or partially treated hypertension can cause a lot of problems, neurological problems. You can get a stroke, you can get heart failure, you can get heart attacks, you get chronic kidney diseases, you get blindness. So the implications of untreated or partially or adequately treated hypertension are phenomenally terrible. I think age has set no bar for any medical disease nowadays. We regularly get patients who are in their 20s and 30s and 40s and 50s, of course, and the older you go, the incidence of hypertension increases. Young hypertensives and patients who are called essential hypertensives. That means they do not have an underlying cause of hypertension. The incidence is alarmingly growing high.
With nearly 1 in 3 Indians with hypertension, the disease, also called the silent killer, is at an all-time high. It is one of the most common causes of premature deaths all over the world and accounts for 50% of strokes and 25% of heart problems in India.
So today, let us talk about what is blood pressure and what should you do about it. Welcome to Doctors on Call. I am Dr. Sonia Lal Gupta.
And I am Dr. Sameer Gupta. Now, blood pressure is a dynamic and a variable phenomena. It is a force that is exerted by the blood on the vessels of your body.
The heart is one of the most efficient pumps in the world. It pumps about 7,500 liters of blood every day. The flow of blood is important so the organs can get oxygen, glucose and nutrition. Blood also helps clear the waste that is made in the cells. The force that the blood exerts on the blood vessels is called the blood pressure. Now your heart contracts and relaxes with each heartbeat, and the force of the blood pressure varies with the phase of the heartbeat. It is the highest when the heart contracts, forcing blood in the arteries, called the systolic blood pressure. When the heart is resting between beats, the blood pressure is at its lowest and it's called the diastolic blood pressure. A normal body has about 90 to 120 mm of systolic blood pressure and diastolic pressure of 60 to 80 mm. You are considered pre-hypertensive if your systolic blood pressure is between 120 to 139 and your diastolic is between 80 to 89. For this, typically the treatment recommended is lifestyle changes. If your blood pressure is more than 140/90, you are deemed as hypertensive and typically require medicines and lifestyle changes. Now, if you have hypertension, your doctor starts you on medications to get your blood pressure below 140/90. But sometimes you may require 2 to 3 medications to get this under control.
Now with medicines, the goal is to keep the blood pressure under 140/90. But the question is lower better? Now this was recently studied in a trial called the SPRINT trial that challenged and studied this question. In this trial, researchers studied almost 9,000 people who did not have diabetes but were at a high risk of cardiovascular disease and divided them in 2 groups. In one group, they started medicines with a goal blood pressure of less than 120 millimeters, called the intensive blood pressure arm, and in the second group with a goal blood pressure of less than 140 millimeters, called the usual care group. The study was stopped early after only 3.2 years, as they found when compared to the usual care group, people who were treated more aggressively, that is, with a goal blood pressure of less than 120 millimeters, had a lower rate of heart attack, heart failure and death overall. Now those treated more aggressively did have some kidney problems and electrolyte abnormalities, but in the end they lived longer compared to those who had their blood pressure treated less aggressively.
This is important because this was a confirmation of the belief in the medical community that in the right patient, aggressive treatment of blood pressure to lesser than 120/80 has many benefits, including a long life.
Now this kind of makes sense because we know that people who are considered pre-hypertensive, that is the blood pressures between 130 and 85 or 140 and 90, they do not necessarily meet criteria for treatment. But when you compare the pre-hypertensives to the people with normal blood pressure, the pre-hypertensives have a higher risk of problems.
So it is important to take your hypertension seriously and take medicines or change your lifestyle so your blood pressure is under control and you reduce your chances of problems in the future.
But please do not self-treat your hypertension, but do it under the supervision of your doctor.
Hope you found this information useful. See you next week.